Hello, this is Kia and welcome to my channel. I have been away for a while now. Last time I made a video was back in 2013. I was in my second semester of nursing school. A lot of you commented on my last video wanting to know if I finished nursing school. You wanted an update. I apologize that it took me so long to make this video. However, I had a lot of upload problems trying to load videos, so I just didn't make them. But now I have some new software, new camera, so now I'm going to try to keep you guys up to date on what's going on with me. First thing is that I did graduate from nursing school. I graduated on time. I graduated in December of 2013, and from there, well, I do have to say that I almost didn't make it out of the second semester. I had a hard time passing my IV therapy class. However, I did get enough points on my final to be able to pass the class, so that was a blessing. And then that was enough, that scare was enough to make me want to just, do my best in third semester and not have that be an issue again, because it didn't feel good knowing that my final was going to determine whether or not I stayed in nursing school. So I can talk about another video on what I did to study and things like that. However, I just wanted to give you guys a quick update that I did pass nursing school. I've been working as a nurse since February of 2014. So I'm coming up on my 2 years working as a nurse in February 2016. Okay, so I'm just going to talk really quickly about some things that I use to study for NCLEX. And the first thing that I used to study for NCLEX was this Tabor's Medical Dictionary. This medical dictionary was given to us during nursing school. So I always keep that because you can always look up medical terms and procedures and anything that you need to know that you don't understand. I even use it as I work right now. Another thing that I did use was Pearson's My Nursing Lab. This basically has step-by-step like complications, method of treatment, what you assess, and things like that, which was very helpful. It helped me to bring back to memory some of the things that I learned in nursing school. And I studied for my NCLEX about 3 weeks. So I graduated in January. I applied for my temporary license. I graduated in December of 2013, applied for my temporary license in December of 2013 because I thought that I would be able to find a job, with a company before I actually passed NCLEX, but that didn't work. Because even after I passed NCLEX, people still wanted me to have at least 6 months to a year's experience. But let me get back to the books that I use to study. Another book that I use is this NCLEX-PN exam cram. And it comes with a CD, which I don't know what a CD is yet, but comes with a CD that has questions on it. And that was very helpful. I think I did those questions. I did at least 100 questions out of there a day. And then I also used this ATI NCLEX-PN review. And my school actually had someone from ATI come out and give us this NCLEX question thing where you can log on and you can actually go to every every section of NCLEX and take the test tests. And I did that every day for 3 weeks. Alright, so another thing that I used was Davis's NCLEX-RN. Now I know this is NCLEX-RN, but I still use this book and it helped me because there are some things that RNs and PNs do the same. The implications doesn't change. So even though This is not a PN book. It still was helpful to me. Alright, so now, in January, I took NCLEX test, passed, first try, 75 questions, the computer shut off on me. I freaked out because I thought that I failed the test. I actually thought that the computer was able to tell in 75 questions that I wasn't fit to pass this test. But nonetheless, I went home. I did do the Pearson view trick, and I did get the good pop-up, but for me, that wasn't enough. I needed some concrete evidence that I was a nurse. So I waited the next day, and like maybe in the early morning part of the day, I saw that my temporary license became null and void, and my practical nursing license was active. And I was like, wow, I'm a nurse. Oh my God, I'm a nurse. So I was excited, of course, called everybody I knew, celebrated. And then, so then I really was like really aggressive with my applications and applying for jobs. Now, I have to say this. I couldn't find a job. Nobody wanted to hire me unless I had 6 months to a year's worth of experience. And that was very discouraging. The first phone call that I got was from a home health agency wanting to hire me as a home health aide with my practical license, practical nursing license. And I didn't have any income coming in at the time because I didn't work while I was in nursing school, and funds were starting to run low, so I needed to take something, so I took that job. I worked that job for about 3 weeks, and with pride, every day I went into work as if I was working under the scope of my practical nursing duties. Then I got a phone call from a home care agency for pediatric patients. So I was excited because I was actually going to be working in the scope of my duty, which was practical nursing, and I worked that job for about 2 months. The only thing I didn't like about the job was that I was actually in patients' homes all day, and I really didn't like that I was in the patients' homes. I would have preferred to be in pediatrics at a facility or in a hospital, but that wasn't the case. But nonetheless, I was grateful. Well, one day on my day off, I went to a nursing home near my area, and I asked to speak to the director of nursing. And when she came out, I basically gave her my resume verbally, letting her know that I was reliable. I live close by. During snowstorms, I am available. I'm an asset because I can work and walk. I can walk to work in a snowstorm. I thought that was a good selling point. She told me to come back in 2 days. I came back in 2 days, and she hired me. And then I was like, oh snap. Like, I am actually going to be taking care of patients by myself. So I had orientation. And I was out on the floor very quickly, and I worked in the rehab part of the facility. So my patient census was anywhere between 20 and 26 patients, and it was the hardest wing on the facility. Probably why they hired me. Nobody wanted to work that wing, and I mastered that wing after a while, so I'm actually able to work in any wing in that facility because I was able to overcome the obstacles that comes with that, working on the hardest wing. So I work at this facility until today. I do plan on going back for my RN. Actually, I did go back immediately. I was back in school in January before I even passed my NCLEX. I was taking my prereqs for my RN. And then life happened, so I had to stop taking classes, and I do plan to go back in the fall of 2016. So that's an update. I won't go any further. I will come back and make another video talking about life as a nurse. I do like working as a nurse. It's different than what you learn in nursing school and what you see in your clinical sites. But nonetheless, it's doable. So if you are a nursing student, or if you are thinking of becoming a nursing student, I would suggest that you, if you have not started nursing school, my advice to you would be to purchase a drug calculation book if math is not your strong suit. I would start learning how to calculate drug calculations now. I would also buy an NCLEX book. And I would learn how to take NCLEX style questions before I enter into nursing school. I think that that would be a good prerequisite for someone who's not used to those type of questions. My advice to someone who's already in nursing school: find one buddy and study with, find someone who is just as hungry for your nursing degree as you are, and stick with that person and hold each other accountable to studying and getting good grades, and find out what works for you as far as studying. And if you don't do good on the test, take that test to your instructor, and maybe you and her him can go over each question that will help you figure out why you chose that answer. Because we all know that with NCLEX style questions, it's 2 definite wrong answers and then 2 possible correct answers. So maybe they can help you with your thought process. Maybe you're reading too much into the question. Alright, I'm talking too much. I will talk to you guys later. Thank you for your patience and waiting for me. Thank you for all of those who still subscribe to my channel, even though I wasn't making videos. I appreciate that. And I do plan to continue to make videos now. So, thank you very much and have a good night.